Patients seeking health services in private hospitals in Kajiado, Narok, Nyamira and Nakuru will have to pay to receive health care as the confusion over the state of financing of the NHIF scheme continues to unravel. The Rural Private Hospitals Association of Kenya says these counties are yet to receive capitation for provision of health care services. This comes as the NHIF management maintained that it has released funds to hospitals. Brenda Wanga reports on the ongoing confusion as the newly introduced Social Health Authority awaits the outcome of several court cases.
We today announced that for NHIF beneficiaries, NHIF cardholders, up to 60% of services will be on a cash basis. All hospitals will charge a fee of Kenya shillings 1,000 for outpatient care. Admissions, surgeries, maternity care, cancer care, dialysis will also be subject to cash payment on a case-by-case basis.
The pronouncement by the Rural Private Hospitals Association a week ago perhaps served to expose the depth of the confusion that now rocks the country's health insurance scheme. The association claimed that the now repealed NHIF owed health facilities upwards of 30 billion shillings and some 4.4 billion shillings as capitation. But in a phone conversation with Citizen TV, the NHIF CEO Elijah Washira says the government has since released 5 billion shillings to health facilities. However, the Hospitals Association says the fund disbursed are below expectations and haven't reached all the counties. The association says the order for cash payment for services in private facilities by NHIF cardholders therefore stands in effect in Kajiado, Narok, Nyamira and Nakuru counties.
Nurses need to be paid. Our suppliers have not been paid for many months now. And we need to keep the lights on. We need to pay electricity bills. Because of this situation, we have no other option left to us. We will not allow NHIF to transition to the Social Health Authority while it still holds debts for hospitals. Dawa ya deni ni kulipa.
The country's health insurance scheme has transitioned from the National Health Insurance Fund, NHIF, to the Social Health Insurance Act with the enactment of the SHI Act 2023 in October this year that came into operation in November this year. However, petitioners moved to court challenging the new act a week later. The courts granted conservatory orders, temporarily halting the start of the transition from NHIF to SHIA. The situation now means that the NHIF stands repealed and ought to have been moved to the authority. According to the transition clause of the new act, on the appointed day, all the funds, assets and other property, movable and immovable, which were held for and on behalf of the fund in the name of the National Health Insurance Fund Board, shall, by virtue of this paragraph and without further assurance, vest in the authority. Indeed, the NHIF is seeking clarification from the Ministry of Health on how to proceed in this state. The repeal of the NHIF also gave way to the creation of a new SHIA board. The existence of both boards that can't act further complicates matters for the new scheme. The NHIF says it is able to operate within its regulations that determine who is being covered and how much the contributors pay, but admits that the two boards aren't able to do much. The NHIF has not handed over formally to SHIA. Brenda Wanga, Citizen TV.